Good morning, everyone. We are Group 7, and today we would like to discuss on the topic of impact of generative AI to different types of jobs in physiotherapy. And here's our overview of the contents that will be discussed today. And let's begin with the introduction. We all are from the program of physiotherapy, and the purpose of the video today is to explore students' concern on the implication for Gen AI on the students' future career in physiotherapy.
So we are going to talk about data analysis and predictive modeling. So for the topic of generative AI and its relevance to the field of physiotherapy, first of all, generative AI refers to a branch of artificial intelligence that focuses on creating or generating new content, such as text, image, and human-like conversation. Regarding its relevance to the field of physiotherapy, it is the data augmentation. Generative AI can be used to augment existing data sets by generating synthetic data that mimics real-world examples. It helps improve the performance of machine learning models used in physiotherapy. For the movement analysis, generative AI can be trained to analyze human movement patterns by processing data like motion capture recordings or video footage. So how generative AI can impact various job roles within physiotherapy? For the pattern recognition and analysis, generative AI algorithms can analyze large data sets such as patient movement data or medical records to identify patterns and correlations. It helps to uncover new insights and refine treatment plan. There is also the sensor technology integration. Generative AI can optimize the integration of sensor technology, such as motion capture systems or wearable devices into physiotherapy practice.
So now let's move on to the rehabilitation and exercise prescription. Generative AI offers significant contributions to personalized rehabilitation programs. By analyzing a patient's medical history and physical condition, such as neurological or musculoskeletal disorders, generative AI can generate the most suitable program tailored to their specific needs. Also, generative AI provides real-time feedback during rehabilitation exercise, analyzing movements, patterns, and maximum weight. This feedback helps patients correct their movements and skills, ensuring the most effective rehabilitation program. Secondly, analyzing patient data plays a crucial role in generating tailored exercise prescriptions. For muscle injuries, such as previous elbow or pelvis injuries, patient data analysis helps determine the seriousness of the injuries. This enables the development of exercise prescriptions that strengthen specific muscle groups and improve balance, reducing the risk of re-injury. Also, patient data analysis considers mental health conditions, such as depression and anxiety. This allows for the inclusion of relaxation techniques, like deep breathing or progressive muscle relaxation, to improve mood and energy levels. Lastly, generative AI plays a vital role in optimizing treatment plans and improving patient outcomes. By customizing exercise prescriptions, generative AI recommends specific exercise based on the patient's medical history and data. This includes balance training and mobility exercises tailored to their needs. Through predictive modeling, generative AI estimates treatment outcomes and guides patients in completing the exercise based on their characteristics and response to therapy. This helps physiotherapists make informed treatment decisions and optimize treatment plans.
Moving on to virtual reality and simulation. Firstly, enhance engagement and motivation. Virtual rehabilitation program powered by generative AI can significantly enhance patient engagement and motivation. Traditional rehabilitation exercise can sometimes be repetitive and monotonous, leading to decreased motivation and adherence. By immersing patients in realistic virtual environments, virtual rehabilitation provides a more engaging and enjoyable experience. Patients may feel more motivated to participate, leading to improved adherence to treatment plans and better overall outcomes. Secondly, safety and accessibility. Virtual rehabilitation offers a safe and controlled environment for patients, reducing the risk of injury during exercise. Additionally, it can overcome geographic constraints, enabling patients to access rehabilitation programs remotely. This accessibility is particularly beneficial for individuals who live in remote areas or have limited access to specialized healthcare facilities. Lastly, data-driven insights. Generative AI algorithms can collect and analyze vast amounts of data during virtual rehabilitation sessions. This data can provide valuable insights into patient progress, performance trends, and areas that require additional focus. Healthcare professionals can leverage these insights to make informed decisions, tailor treatment plans, and track patients' rehabilitation progress more efficiently. Let me pass the time to my groupmates for the next part.
Let's move on to assistive device and robotics. The impact of generative AI in physiotherapy is AI can provide rehabilitation monitoring and feedback. For example, wearable sensors, it can track data related to joint movements and heart rate. So AI can analyze this data in real time and provide feedback on patients' performance. As I mentioned in the last slide, motion tracking camera can provide feedback and assistance immediately. In addition, AI can adapt to patients' needs and abilities, which can provide personalized assistance according to the patient. I believe that they can improve the accuracy and safety. When they guide patients, they should ensure them to have a correct posture. By detecting errors in patients' movements, AI should provide real-time feedback to reduce the risk of injury.
Now let's move on to the ethical consideration and human expertise. For the ethical consideration, data privacy and accuracy are critical considerations in physiotherapy. AI requires patient data to provide personalized treatment plans. However, it is essential to prioritize protecting patient privacy. Accuracy is crucial, but there are uncertainties and individual factors that may contribute to injuries. AI may struggle to account for these complexities accurately. For the importance of human expertise and judgment in the field, physiotherapists need a good communication skills and involved in decision-making and continuity of care. So, how generative AI should be seen as a tool to augment and assist physiotherapists rather than replace them. In physiotherapy, access to research and article is crucial. AI can provide recommendations for at-home care, and physiotherapists must explain this recommendation clearly. AI also has access to a patient's history, allowing physiotherapists to make necessary adjustments to their treatment plan.
So for the conclusion part, there are both strength and weakness in using AI, but overall, AI can help the physiotherapist effectively so as to assist the patient from injuries. So for the reflection part, we've divided into 5 parts to discuss. The first part is the text to image, and we've generated a few images by generative AI. The first one is the robotics in physiotherapy. The second one is the real-time feedback provided by AI in a physio clinic. The third one is the communication with patient. The fourth one is the ethical consideration, and the last one is the long pathway to recovery. So the second part is we use AI to create video content. Our prompt is what are the content of our video of impact of generative AI to the different types of jobs in physiotherapy. And it enables us to generate content more efficiently at a faster rate. Thirdly, we have asked AI to generate a script. We have added the slide and asked AI to help us to generate it. And this is examples that we didn't ask AI to generate within a time limit so that it's too long. And after that, we have emphasized again to ask it to generate within 20 seconds so that it will fall into our time limits.
Moving on to the difficulties we encountered during this project. Firstly, the limitation on generating image. While we are trying to generate image using text-to-image technique, we found that when we try to prompt AI to generate image related to medical field, the AI failed to generate any image. Secondly, inaccuracy of AI. Since some parts are quite similar, while we use chatbot to find out the answers, the AI tried to give answers that are very similar, that the answers are not precise enough so that we need to do research on ourselves afterwards. Thirdly, is difficulty on prompting. While we are trying to generate image, sometimes AI fails to give us the image we desire, so we need to try multiple times on prompting the AI to give us the image we desire.
We know more about the use of generative AI, such as the text-to-image and how to generate scripts. We also know how can AI assist physiotherapists and how it helps to speed up the recovery process of the patient. And we also know the shortcomings of AI.
This is the end of our presentation. Thank you.